Welcome back. Thanks for sticking with us. The Medicare annual enrollment period has just begun, and now is the time to familiarize yourself with the available plans to make sure you have the healthcare coverage you need. Today, Mike Bertaut, a healthcare economist for Louisiana Blue, is here to talk about the best way to find the plan for you. Mike, welcome back. My goodness, a year has gone by already.
Man, it just flew by. I missed it.
I know, right? Well, look, we still got a lot of year left, and it is important that for people who are just turning 65 or over 65 that you listen up, because Medicare open enrollment is happening right now. But I was reading that Medicare is not just for people who are 65 and older.
You know, that's true. Medicare has a population inside of it of folks that unfortunately have a permanent disability or end-stage renal disease or some other disease that is hard to manage and expensive. After they've been in that program for a while, Medicare will take over their care. In fact, about 1 out of every 5 people in Louisiana in the Medicare program is under the age of 65.
Unbelievable. I am glad we are having this conversation. It is already open. You have until December 7th to enroll, make any changes, make sure you all know that, and of course coverage will start at the top of 2025, January 1st. But let's talk to the people who maybe just turned 65.
Yes.
How do they choose the right plan? Because there's so much jargon when it comes to healthcare coverage sometimes.
Well, the important thing to remember if you're aging into Medicare, if you're turning 65, is not to be in a hurry.
Okay.
Because you've got 3 months before your birthday, the month of your birthday, and then 3 months after you turn 65 to make a decision. So you don't have to snap into it. What we really want is to folks to focus on making sure that the plan they settle into fits their needs, exactly who they need to talk to. If they make a mistake and they pick the wrong plan every year, we have an open enrollment period. It starts on the 7th of October, 15th of October rather, and goes all the way to December 7th. And during that period, no harm, no foul. If you're unhappy with the plan you're in, you can switch to a different one.
That is good to know. Yeah, we have some visuals if we can show people that it's so important when choosing the right plan that you really take into account what is best for you. You also have the 3 Ps. You know, I love your 3 Ps. Yeah. Provider, pharmacy, and plan value.
Yes. In fact, you know, most of the people who have what I call buyer's remorse, where they get into a plan and they really don't like it, the main drivers are their doctor's not in the plan.
It happens.
Their hospital's not in the plan, or a medication that they really need is not covered by the plan they're in. So we want to do that up front. We want to scan the plans and make sure that our provider's in there, our medications are in there, and we know what the copays are going to be. You can find all that out ahead of time. The best way to do that, my goodness, get an agent. Don't do it by yourself. Working with an agent is free. There's no obligation to buy anything, but these guys and these nice ladies have done this work already. It's very important that you use their knowledge as you go forward.
And there's no obligation to buy. They just want to hopefully help you pick the best plan. Because like I mentioned, it can be very confusing, and you're seeing commercials ad nauseum right now talking about the different parts of Medicare, A, B, C, and D. Break it all down for us, please.
Sure. Medicare, because it was originally made back in the 1960s, is a little bit different than the other kind of insurances you buy. It has Part A, which covers your hospital care.
Okay.
It has Part B, which covers your doctor visits and outpatient things. And then you have Part D, which covers your drugs. If you get a Medicare Part C plan, you have the opportunity to get all of that rolled up into one plan, which is very convenient and a lot easier to keep track of. So that's kind of how it breaks down. A for hospital, B for doctors, D for drugs, and then Part C if you want to roll all that up into one plan.
Got it. And we get to pick and choose, because what's great about open enrollment is that, yes, it's for people who may be aging into Medicare, but for people who have been on Medicare, we can make changes.
Yes. Yeah, and that's important because tens of thousands of people every year in Louisiana are going to turn 65.
Woohoo!
I know, and I'm like a year and a half away.
Congratulations! That's good.
So I do think about this stuff. But the reality is, you know, you don't have to get it right the first time. It would be nice. But things change. Plans change. Provider networks change. So that window every year where you can change plans is very important. And remember, just because you change during the window, the new coverage doesn't start until January 1.
It's so important, and you know, yes, we're having a conversation right now about Medicare, but Louisiana Blue, you all have this Medicare Made Easy series on YouTube that's available for people to learn more about?
Absolutely. On our YouTube channel, you can see professionals, guys who've been there and done that, talking about how to choose a Medicare plan and what the benefits are. And I highly recommend the Blue Cross YouTube channel.
Come on. Well, look, Mike, thank you so much for joining us. Congratulations to everyone who just turned 65. That is a milestone. And look, if you all want more information about Medicare's annual enrollment period, which remember ends on December 7th, log on to bcbsla.com/Blue Advantage or call the 1-800 number on your screen. Do not forget, agents are available from 8 a.m. to 8 p.m. 7 days a week. Just call that number for more information. All right, stick with us, everybody. We'll be right back with more Great Day Louisiana.